Now, delirium, one of the ways you know it's delirium and not Alzheimer's, because Alzheimer's disease is a slow, gradual thing. It slowly, gradually gets worse over the years, okay? Not over days. This kicks in days, hours to days. So the person with delirium, you know, they change quick, and they're dramatically confused, disoriented, they don't know where they are. They start to pick at the air sometimes. They start to, you know, get obsessed about the wrinkles on their clothes or fuzz on their clothes, and sometimes you don't even, there's no fuzz, but they see it, and it's very disturbing to them. And so they have visual hallucinations, seeing things. They get paranoid. They, like I said, dramatically more confused. And the thing is, if you treat the illness, you treat the bladder infection or the pneumonia, or you get them off the medicine that they're taking that's causing it, they'll get better fairly quickly. And again, in days to weeks probably. Before, whereas with Alzheimer's disease, you know, that's something that doesn't change quickly. Either whether it gets worse or better, it doesn't do anything quickly. That's one way to tell. The other way to tell is Alzheimer's disease patients typically are about the same throughout the day. So they're kind of confused, and maybe they have little moments where things get a little better, but most of the time, you know, they're kind of having their baseline level of confusion. With this disease, you might see them in the morning and they're fine. They know where they are, they know what's going on. And then the afternoon, they have no idea. So it changes that dramatically and that quickly. Sometimes their level of consciousness is impaired too, meaning that one time you go in to see them and they're alert and awake and talking to you, and the next time you go in to see them, you can't even get them hardly aroused, and they're kind of, you know, eyes are half open and they're mumbling or slurring their speech, things like that. I told you that with delirium, you got to figure out what's causing that. One of the things that you really need to watch is over-the-counter medicines, like any of the cold medicines that can make you sleepy, or any sleeping pills. Anything that you take that's over-the-counter that makes you sleepy, a lot of times those will have things like Benadryl in them. The generic name for Benadryl, I should have written it up here, it's kind of a big word, but diphenhydramine is what it's called. And it's in Tylenol PM, it's in Sominex, I believe, it's in NyQuil, it's in a lot of things that make you sleepy. So anything that makes you sleepy that's over-the-counter, you really need to be careful. Probably don't give that to an Alzheimer's disease patient. And as a matter of fact, anybody that's, even if they're older and don't have dementia, probably should be careful taking that stuff. If you needed something to dry you out, like a cold pill or something like that, I mean, some of the newer Claritin, things like that are a little safer probably. They may still some risk of this, but not near like Benadryl and some of the other ones. So that's something to keep in mind. And then, you know, like I said, if you have somebody who has this, they need to be in the doctor's office or in the emergency room, one of the two, because you've got to treat that. You got to figure out what's causing it and treat it, and then it reverses, and then they should come back to where they were in their level of confusion as part of their Alzheimer's disease. Incidentally, you don't have to have Alzheimer's to get that. Anybody can get that. It's just a matter of how much you block down this chemical in your brain. So you have a bad head injury, or you take enough Benadryl. If they could say, you know, I took an overdose of Benadryl for some reason, trying to get to sleep, I don't know. I might be pretty loopy, and I might not be able to think very straight. I'll give you an example. I don't know if anybody ever been on a cruise before. Anybody take those little patches you put behind your ear that keeps you from being sick? Anybody ever done that? I went on a cruise this June with some friends, and I put one of those patches on. I'll tell you what, I was not quite as clear as I typically am. I think I was probably, you know, I wasn't sure. It's a good thing I wasn't driving or, you know, having to find my way around or anything, because it was a cruise, luckily, and they told me where to go and all that. But other than that, I mean, I was a little confused. Can cause anything that blocks this chemical can also cause dry mouth, difficulty urinating, things like that, sleepiness. So those are other side effects. If you start seeing somebody who has Alzheimer's disease and starts complaining of those symptoms, you might make sure you're looking at their medicines to make sure there's nothing that was recently added that's doing this. The technical term for a medicine that does that is an anticholinergic. Why? Now that looks a big word, and everybody's going to be frightened by that, but look, anti means the opposite of or to block something, okay? Cholinergic looks just like this, doesn't it? Cholinergic. So it's basically blocking this, okay? So you could impress your pharmacist or your doctor, and the next time he wants to give your family member who has Alzheimer's disease some medicine for sleep or whatever, you could say, "Doctor, does it have anticholinergic properties?" And he'll probably, his jaw will hit the floor, you know. Whoa, I'm not sure. Let me look that up. You know, so it's something to know about for sure if you have anybody that you know that has Alzheimer's disease. There are some other things that you should probably be aware of that, you know, when let's say, for instance, you think you have a loved one who might have Alzheimer's disease and you're taking them to the doctor, one of the things the doctor's going to, one other things that the doctor needs to look at or needs to think about that could present like Alzheimer's disease but might not be Alzheimer's. You remember last time we talked about depression, and I talked about having a patient who looked like he had Alzheimer's disease, but he was depressed, severely depressed. And actually this case we gave ECT, and he came out of it and does not have Alzheimer's disease. As a matter of fact, memory was totally normal after the treatment of the depression. So depression can cause something that looks like Alzheimer's disease. The tough part is that a lot of times that's the first sign you see of Alzheimer's disease. Somebody will get very depressed, and then later on, maybe a year later, maybe longer, but they end up having Alzheimer's disease at some point. Probably again because there's some damage going on in the brain, but it's unbeknownst to anyone. We can't tell that. There's no way to tell that. So the depression definitely needs to be treated either way. If you treat the depression and it's fully treated, and the person still has memory problems, then it's likely you had both depression and dementia and Alzheimer's disease. There are some medical problems too that folks need to be aware of, and the doctor needs to be looking for when he is taking care of somebody who may have Alzheimer's disease and trying to figure that out. Low thyroid. I know we talked last time about that with depression, and it also can cause something that looks like dementia, like Alzheimer's disease. So it's a simple blood test. Basically, the doctor checks the blood test, and if it's low, if the blood test looks a certain way, he can tell if the thyroid is low. And if it is, then you need to treat that. Incidentally, a younger person that has low thyroid can also have depression and have trouble with memory and things like that from low thyroid. So something to be aware of. We talked last time too, a lot of these things are similar between depression and Alzheimer's disease, but we talked last time about vitamin B12. If you don't have enough vitamin B12 in your system, and a lot of older people don't because you have to be able to absorb it in your gut, and there's a certain way that happens. Older people sometimes lose that mechanism by which you absorb it. If you lose that, or if you just don't have a very good diet, you don't get B12 in your diet, you can check a blood test and see if your vitamin B12 is adequate. If it's not in the normal range, or if it's in the low normal range, all you have to do is take vitamin B12. Then you repeat the blood test and check it. If it looks normal, then it's not an issue with your gut, it's just a diet thing. If there's something wrong in the gut, you won't be able to absorb it by mouth, and you might have to get a shot every month. But still, it's a pretty easy thing to do. And again, you want to treat anything that can potentially help the memory, right? You don't want, if somebody's already having some Alzheimer's or some problem with the memory, anything you can do to revert to treat it. If it's low thyroid, if it's B12, if it's depression, those things are all treatable, easily treatable. So you gotta find those things out. Another thing that throws the older folks, I think, little old lady comes in and sees me, and I say, Mrs. Smith, I know we're concerned about your memory, and we think maybe you might have Alzheimer's disease. Well, one of the tests I need to do on you is I need to check for syphilis. And again, jaw hits the floor. Me? I would never know. The issue though is that this has happened in real life, that folks have maybe had a spouse who had an affair early in life, but what happens is with syphilis, you can get it sexually transmitted, like that's how you guys all know about it, but you can get sexually transmitted syphilis, and then it doesn't get fully treated, or you never knew you had it and didn't get treatment. It can sit in your nervous system and sort of sit dormant, is what we call it, kind of hibernates, I guess, for years, 20 years, 25 years, something like that. If it then comes back, it can actually start to damage the brain, and it can look like Alzheimer's disease. But it is an Alzheimer's disease, and it's treatable. It's still treatable at that point. You can use antibiotics for that. So what you do is you do a blood test, and you look for this evidence of syphilis in the blood. And it's basically antibodies to the syphilis. If that's positive, you have two choices. One, just treat with antibiotics. Usually penicillin is what they use for that still, believe it or not. And you can either do that, which is usually easier, or you can do a spinal tap and check for evidence of the syphilis in the brain. If it's in the brain, then of course you have to treat, and you need to treat until it's negative. So that's something else that's kind of reversible, that if you treat it, it It may not give you a lot of function back. If you've already lost nerve cells from it, they probably won't come back, but at least you'll stop it. You'll maybe stop it in its tracks instead of it getting worse.